Hello, Professor. This is my public health and news presentation, and my source was from Reuters, and the link is here. And this story was published on November 22nd, 2025. And it's about H5N5 bird flu, or the avian flu. So, in this article, it showed that this past Friday, the first confirmed case of avian flu, or H5N5, has actually died in Washington state. And this is the first confirmed case where we know this in the United States. Now, this is where public health in the news actually becomes very personal. And I was very surprised when I saw this. This happened in Grays Harbor County in Washington State, which is really, really close to my grandma's house, actually. She's about maybe like less than half a mile over from where this actually happened, which really freaked me out. I was going to report on a different topic, but some time passed, and also I feel like this was way more relevant, so I changed it to this one because of how crazy the story is, because with how it became kind of personal. So I immediately told my grandma about it, and she was pretty relaxed because, that's how old people are. But I told her to like maybe start wearing a mask when you go to the store or something like that. Now, when it comes to this first confirmed case that died from H5N5, the person did own a backyard flock of domestic birds. This person owned multiple different variants of birds. They had like chickens, roosters, they had like geese, I believe. I don't know why, but this person did have a very random arrangement of birds in their house. And in like the most or least morbid way possible, I feel like this is kind of reassuring for the status of this disease, because if this person got the bird flu from all these random birds maybe being around together, it's more reassuring knowing that it unfortunately happened this way, instead of this guy bought like chicken at like the store and then he cooked it and ate it and that's how he got it. Because then it would show that like it's already in our food supply, which is really, really would be even more concerning. Now, according to the article, public health officials say as of now there is no proof of human transmission, but again, there could be right now. We just don't know because it's not been confirmed yet. For H5N1, which is the other bird flu variant, the fatality rate is 50 to 55%. Now, this fatality rate could be higher because when this happens in other countries that are less developed, they have less ways to treat this, so therefore more people will die, which can increase the fatality rate. It's kind of like Ebola. If you have Ebola, but you get transferred to a Western country or a more developed country, you have a lower rate of fatality on average because they're able to properly treat you on time, even though it's a very harsh disease. But I do think that this is still very concerning nonetheless, because if the other variant of this same flu, but again, different variant, if the fatality rate is over half of all people die from it, I think that's extremely concerning. Public health officials, though, do say that the risk to the overall public is very low currently. But, as much as we should trust them, I think that we should still be concerned because this topic of bird flu has been going around for about over a year, and it seems that we don't have as much funding as we did in previous administrations to actually properly make sure that we do have good public health systems in place in case there is issues that happen. Now, my discussion question to the class would have been, what should we do to make sure that bird flu does not become a pandemic? My answer to this would be we need to increase funding overall for public health so we can actually monitor all across the country where cases pop up, because again, although public health officials do say there is no sign of human transmission and they say that the risk is low, that also could be because we do not have enough resources to actually make sure that this is not spreading like crazy everywhere else. I do think that we should also maybe ramp up vaccine production for these other variants, or not production because we don't have the research for it yet, but research more on this topic to make sure that we are actually able to combat this if it does become a pandemic. But yeah, thanks.